Hello and welcome. I'm Jeremy Searle and this is our show about things happening in and around and to the city of Montreal. And today I'd like to address the issue of fluoridation of water, which comes up from time to time. There's a constant recurring lobby to have fluoride put in the water. Well, those of us who follow these issues know that fluoride has a beneficial effect in protecting teeth, which is the idea of the exercise. But we also know that fluoride is a poison. It's a poison with all sorts of deleterious effects on the human body. Why am I opposed to fluoridation? And I certainly am opposed to fluoridation. It's because it's used generally by governments, by authorities, administrations that want to avoid responsibility to giving proper healthcare treatment to those with very little money, the poor. Certainly in Montreal, in Quebec, the government fails to provide the resources for all children, and of course it's children that are the most important because they have the growing teeth. We have governments, successive governments, which fail to provide sufficient funding for dental care for the younger. Children of those with more money get special brushed-on fluoride treatments. All sorts of have to be paid for above the Medicare system treatments, which those without money don't. The result is that if, for instance, you have children such as mine, 20 and 17 years old, they have perfect teeth, whereas the children of those with less resources come up with the cavities. The children of those with less money could have just as good teeth if they had the same dental care. But wouldn't it be convenient if instead, as we have through the rest of Quebec outside of Montreal, if instead we could announce as government that we have put fluoride in the water, low cost, poison in the water, no good for the adults, but now you've diverted the discussion away from proper health care, sufficient health care for all children. And I might add that if we were to introduce fluoridation of the water in Montreal, there would be a secondary, very, very serious negative effect. Quite aside from the fact that it would essentially help no one and hurt a lot of people, bone cancer possibilities, all sorts of health risks associated. But it would also drive people who were concerned with their health to start drinking bottled water to get away from the fluoride. We already have a large section of the population which, for reasons are difficult to understand in Montreal, regularly drink bottled water, the municipal supply being better. But if the municipality, at the behest of the provincial government, were to start poisoning, because that's what it is when you put fluoride in the water, then serious, environmentally concerned, health-conscious people would be increasingly driven to drink bottled water. And of course, every time somebody drinks bottled water, they're wasting plastic, non-renewable oil resources, and that's in nobody's interest. So forget about the fluoridation and let's move towards a more caring society, please everyone, in which we actually provide proper dental care for the children of those people who aren't able to pay for those superior services. I would just conclude by pointing out that as a child in England, I, like everybody else in England, was subjected to fluoridation. It did nothing whatsoever. Like my confreres in England, I have cavities. That's the way it is there. I never met an English person who lacked cavities. And the reason is that we lack proper dental care. As a child, dental flossing hadn't been introduced. We didn't have the pasting on of the fluoride. We didn't have proper dental care. It wasn't properly understood. The fluoride didn't protect us. Without proper dental care, without regular proper treatment, you get cavities. So, little honesty here, drop the fluoride, support proper dental services for the entire population, and then we'll all have better smiles. Something to consider, but which I consider very important. Thank you and good day to you.